husband needs help!
What's going on, ma'am?
His penis is very swollen.
I had an allergic reaction.
Ugh! It feels like it's gonna fall off.
I'm gonna have you take your pants off. How did this happen?
It's all my fault. I read online that you could use coconut oil for vaginal dryness, but he has a nut allergy.
Gotcha. Okay. No worries. We'll get you back there and get that taken care of right now. Your husband is doing much better, ma'am. He's almost ready to go home.
Oh, thank you.
I would avoid any more coconut oil in the bedroom. Yes, of course. I would suggest trying other vaginal moisturizers like KY jelly. Jelly? Yes, KY jelly.
If I don't have KY jelly, can I use grape jelly?
No, nothing from the kitchen.
Oh, okay.
Mississippi sidecar. Legit true story. Patient was admitted to med-surg for perforated stoma. Patient told the GI surgeon, times are hard, you have to do what you have to do. As her nurse, I responded, sister, times aren't that hard. A stoma is when they cut a hole in your stomach and they take a piece of your abdomen so that poop and piss and digestive stuff can come out of there. Sometimes because if your digestive system is all fucked up, they'll poke a hole and stuff will come out. A Mississippi sidecar is when someone uses that hole to have sex with. So this patient has a hole in her abdomen and was using it for sex. I know, it's gross.
Sir, I am not in the mood to be assaulted by a stranger right now.
They told me that you're the one that saved my Lori.
Oh, your wife. Yes.
Thank you. Thank you.
That was nice, how it ended. The family member of the patient that was saved comes and hugs the healthcare provider. It happens sometimes in the ER. Think about it, okay? The emergency room is a place where we stable patients, keep patients stable. If they're really in a life-threatening situation, the ER stabilizes them, and then they go upstairs to surgery or whatever else they need. They're probably going to the ICU. It takes time for people to get better. Rarely do you see someone just come back right away like that. A lot of the thanks goes to the nurses who aren't in the ER. But that was nice. When I worked in a small town hospital, there was only one RN per shift. About 2 a.m., a guy called about his wife. He said she had an episode, so he brought her in. The young couple was married for about 3 months. I asked her to describe her symptoms. She felt like she was going to faint. Her husband said she was shaking, and her eyes rolled back in her head. She felt hot. I took her vitals, and they were good. Then I asked the most important question. What were you doing when it happened? They both blushed and finally said, making love. I had to control my laughter and then explain very gently to them what an orgasm was and that it was normal. They thanked me and headed home. No doctor needed. A good story that broke up a quiet night. I love these small town hospitals, man. This is hilarious. They didn't know it was an orgasm. An episode? I don't know if I've ever given a girl an episode. I've definitely given a girl a commercial break. Ladies, if you want your man to love you forever, take him to the hospital and have a doctor explain to them exactly what an orgasm is, so they know what to look for. Good luck. True love story. Patient was on our cath lab table ready for a heart cath. The only reason we would ever call the cath lab is if you were having a heart attack. And a heart attack is when there is a blockage preventing blood from going to your heart. They will go in, they will prop open your arteries, put a tube in there so that it allows blood to flow directly into your heart. He has anxiety and kept saying he has bad luck. I assured him he was safe with our team. He said, no, you don't understand. My luck is bad. He said, I'm so unlucky that if you threw me in a barrel of titties, I'd come out sucking my thumb. I mean, that is pretty unlucky, but where is this barrel? And is there a line? Is there an appointment that I can sign up for?
I don't know if I can even tell this one with a straight face, but I was taking care of a patient and I had a med student. The patient came in with a rectal prolapse. Rectal prolapse is when your rectum turns inside out, sticks outside of the body. So the med student tried to push it back in. He couldn't get it back in and he asked me, what else can we do? And I told him, well, you need to find some sugar because we put sugar on a rectal prolapse and when you do that, it draws out the fluid and you can push it back in. And so this is the middle of the night and he tells me, well, the cafeteria's closed. You know, I don't know if I can find any sugar. I tell him, well, just go see what you can round up. So I go back to the room and I'm trying to put the rectal prolapse back back in the room. And guess what he walks back in the room with? I am not kidding. The Snickers bar. Imagine the look on the patient's face when we pull out a Snickers and we tell him we're going to fix his rectal prolapse with this. I mean, Snickers always satisfies, but I don't think that's what they meant.
All right, I learned something new. Put sugar on a rectal prolapse to suck up the moisture and push it back in. Kind of like salt on a snail, I guess. What you can't do is rub a Snickers bar on a rectal prolapse, hoping it'll go away. Good on the med student for trying. You ask for sugar, you're getting sugar. Psych patient who was being watched by police managed to climb up an x-ray machine that was mounted on the ceiling and ended up in the ceiling crawling around. We had to move a family who was in the room next door as their relative had died. The ceiling crazy man ended up falling through the ceiling tiles and would have ended up landing on the dead body. Talk about lucky. He could have ended up anywhere, but right next door and fell down. I've never had a patient crawl into the ceiling. People tell me it's happened. Good news for the patients who could possibly have been injured by a man falling through the ceiling is that they are already in the hospital, so they can get treatment right away. I am always looking on the bright side for you guys. I took a patient to surgery and removed all his teeth. 1 week post-op appointment, he whispers to me a question. He wants to know when he could go down on his girlfriend. I appreciate the dedication to love, but I had to remind him he had 32 open wounds in his mouth. Maybe give it a few weeks or we'll see you again. Good job, man. Nothing will stop him from eating out his wife. I think, did we say wife? Girlfriend, eating out his girlfriend. Imagine what he could do for his wife if this was just his girlfriend. Whispering with no teeth sounds hard. When can I eat the Irony is not being able to go down on your girl because you're bleeding. I worked as a forensic nurse and had to complete a suspect exam on a very tall man accompanied by 3 police officers. A suspect exam is when a nurse will come in to gather evidence that may or may not link a patient to a crime. In this case, likely a sexual assault crime. One officer told me he is feisty. I explained the exam, and when I showed him the very large swab I was going to use to test for STIs, he yelled, "Nah, you ain't!" So I said, "This is nothing. Wait until I have to pluck out those pubic hairs." He then attempted to get out of the room and was tackled by police officers, held down, while I happily plucked 25 pubic hairs while humming the song from Bad Boys. 25 pubes is oddly specific. Like, is that the recommended quota by forensic nurses? If you want 26, do you need a warrant? Honestly, the real crime was how happy she was doing it. 5 pubes, that's data. 25 pubes, that's personal. She didn't just do her job, she was a pluck above the rest. Medical mysteries with Bill Gates. Is this good advice or bad advice? When you have sudden onset of stomach pain, eating or drinking something will make it better.
Oh, that's probably bad advice.
Bad advice. Correct. It is bad advice. Because if your stomach is in pain, eating or drinking something will oftentimes irritate it even more. So you want to give it a rest. That's the first thing that we tell you when you come to the ER too. When you come to the ER, if you have anything that's wrong with you, we tell you not to eat or drink anything until we find out exactly why, in case you need emergency surgery. So your stomach has to be empty because it'll complicate the surgery. I've had surgeons oftentimes will delay surgery if you've had anything in your stomach within the last 24 hours. Right?
Because you could, I guess, get sick and that would be hard to breathe then?
Yes. So if you're on anesthesia, your muscles aren't working, right? Any contents from your stomach that leaks out of that tube that goes into your stomach could go into your lungs, causing you to aspirate and choke and die. Oh. Ha. Yes, appendicitis. One of the most common emergency surgeries that comes in. Does it feel like a fart? I don't know. I've never had an appendicitis. But ladies, lesson learned. Always fart in front of your husband to prove to them that it actually is indeed a fart.